So it's interesting how we can sort of fall into these different areas and then we make the most of them and then we grow and we hope to be a strong voice within them. And I think you certainly have become that voice in sex research or sexology. With that, however, also comes a lot of controversy. So can you elaborate on when you first became embroiled in controversy?
That would have been around 2003. In the mid to late 80s and early 90s, I had written several papers on, essentially they were descriptive pathology of gender identity disorders. When I wrote those papers, I was writing for specialty journals which had paid circulations of like 1,000 subscribers. And this is who I was writing for, a handful of clinicians who saw gender identity disorder patients on more than a once-in-a-lifetime basis. But then the internet came along. A few years after I had actually quit writing in that area, the internet came along, and a couple of people who were on the internet became interested in my papers. And so they started getting out into the larger public. And then what really blew the lid off was when Michael Bailey, whom I believe you've already interviewed,
Yes,
wrote a book which was intended for a lay audience. And he based a lot of the book on work that I had written about a certain type of male to female transsexual. He was attacked for his work. The activists who went after him tried to get him fired from his job and to ruin his career. And because he was basing what had offended them on what I had written, I became part of it. I got embroiled in it.
And can you just sort of briefly describe what kind, I'm going to say, insight you had into the world of gender identity disorders, or in this case, male to female transsexuals?
What I had said was that there are two ideologically different types of male to female transsexualism. They're similar, only that they eventually present with a request for sex reassignment surgery, but where they're coming from was very different. And beyond that, I said one type was associated with ordinary homosexuality. You might think of them as like Kinsey nines. And the other type were associated with an erotic excitement at the idea of being or looking like a female. Something similar to the old concept of fetishistic transvestism, except I made it more general. So what really was hated in my work by activists was my statement that although gender identity disorder is not the same thing as sexual orientation, gender identity disorders are always associated with one or another of two erotic anomalies, either the erotic preference for members of one's own sex or the erotic desire to become like a member of the opposite sex.
When I teach about this, I explain why I can understand that someone who's transgender might take some umbrage at that, let's say, the description. But why do you feel that people got so upset over this characterization?
Well, I think it's important to point out that not every single patient of this type got upset at it.
Very important. Very
I was back channeled many times over the years by people who said, "Thank God I finally read a description that fits my experience. What a relief it's been to me." But those are the ones who tend to back channel and not to go online. The ones who went online, I think it was offensive to them in two ways. I think it kind of invalidated the fantasy they were building up about themselves. It contradicted their notion of themselves. They really wanted to go with the woman trapped in a man's body, which often became lesbian trapped in a man's body. They wanted to go with that. And although I never ever said this type of transsexualism is nothing but a sexual fetish, that was how they read what I was saying. What I said was, this is the foundation, the basis. This particular erotic preference gets the ball rolling, but this type of sexual preference, which I called autogynephilia, can result in a gender identity inversion that has much broader ramifications.
So I'm going to ask you the same question I asked Michael Bailey. Just I want to hear your perspective, because and I've always said this, and we've had communications on Twitter or in SexNet listserv, and I acknowledge this. My perceptions, it's anecdotal, and it's a very small n. So if I say that the few people, and I think I already know your answer, but if I said the few people I've spoken with, let's say they're all adults, they're mostly men, but they basically said, no, I am not gay. It would be the autogynephilic in the sense of it's a man who still loves women, has no interest in men, but they say, I've never had an erotic fantasy or desire to be in a woman's body. I don't masturbate thinking about that or anything like that. So if someone presented that way, but they said, yes, I'm definitely a woman, how would you describe their situation?
Well, okay, let me answer a slightly different question than you asked. I know for a fact that many autogynephilic male to female transsexuals are not truthful about their history of sexual arousal with cross-dressing. You know this either because they've changed their story when you look at their clinical charts and they said something different 5 years ago from what they're saying now. Sometimes you know it because you get to talk to the wife and the wife gives a picture of what their sex life had been that's totally different from what the patient tells you. So the question becomes, okay, you have a guy who comes in, a biological male. He looks like all the other biological males who acknowledge that they did have a period when they always or usually masturbated or ejaculated with cross-dressing. So your patient who says, no, this never happened, looks pretty much like all the other ones, except he says, no, I was never sexually aroused by putting on women's clothes or thinking of myself as a woman. So then you have to ask yourself, okay, which is more probable, that this guy is in denial, lying to himself or to me, or that I've discovered a unique major third type of transsexual?
Right. Yeah, that's what I thought would be the answer. And I mean, it makes perfect sense what you're saying, statistically speaking or probability wise. But do you think it's possible, since we know there are many men or women who their whole lives are trying desperately psychologically to deny, let's say, their sexual orientation? So do you think that in those cases where they do deny it, let's say maybe they've never really acted on it, do you think that they've repressed it so much that they can't acknowledge it? Or do you think by the time they're an adult, they must have recognized that they have that attraction or that erotic fixation?
No, I actually think that some of them, especially the ones who are so averse to their penis that they act like it's something they have to handle with tongs and don't even want to touch, I think some of them might actually be totally out of touch with the fact that there is some erotic frisson to the cross-dressing. I mean, they don't all get raging erections when they put on a dress. Oh, you know, most men, you go through days, there are fluctuations in penile blood volume in response to mild stimuli that people aren't even generally aware of. I think it's possible that they can cross-dress or do some other thing that symbolizes femininity to them and overlook mild degrees of penile tumescence that pass after a minute or so. I think that's possible.
Okay. And the more and more that I'm talking with people, a big part of me, a much larger part of me, is revising the way I see it. Because originally when I first started teaching about this, again, because of my limited experience, and they had no reason to explore their sexuality with me. All they said was, though, that, you know, they always say Bailey because we talked about Dr. Bailey, but Bailey's wrong. That doesn't characterize me. So having spoken with a number of experts now and more people in the field, you know, I am beginning to revise it quite a bit, and I just hope that people can recognize that everything you've said, you say it in such a kind of clinical way. You're not making any value judgments about it. You're just describing the experience. And I hope people can come to see that there is no values or morals being imposed on this.
Well, as I told you, the circumstances when I invented the word autogynephilia, I thought I was writing for maybe a few hundred people around the world.
Right.
I certainly did not invent the word as a term of reproach. Now I think a lot of trans activists are trying to sell it as a bad word. This is a word that should never be uttered in polite society or anywhere else. But that's the spin that they're trying to put on the word, because they actually want to obliterate the concept from public awareness. They're not concerned about what word is applied, and I think they're only secondarily concerned about what stigma is attached to it, because they're basically the ones who are connecting it with stigma. I think they don't want the concept to exist. They don't want people to think about it.
Right. There is, I've mentioned her a few times now. I think you may have blocked her. I know Michael did. A trans person, Olivia. She comes on Twitter feed all the time. Anything comes up at all, I could use the word, transponder, and she'll come up and say, aha. And she's being very blunt, direct. She believes that Dr. Jordan Peterson and I and you are colluding to destroy trans people. I've heard her story. I think she's had a very traumatized life as probably an adolescent, as an adult. I've seen a video where she was kidnapped. I know she's coming from a place of pain, a lot of pain. So when you say that the trans people are the ones who are stigmatizing, she will turn around and say, but no, in Texas, where she's from, there were all these commercials where they were trying to overthrow the bathroom bill, and they were saying it's a bunch of, these trannies, these disgusting trannies lurking in bathrooms wanting to rape children or rape women. So she would argue that it's society that's stigmatizing, not just the trans people. Is there not credence to the fact that there are many people who would like to, and no matter what you say, use that to turn around and say these people are disgusting, reprehensible abominations?
Well, the people who don't want male to female transsexuals in women's rooms haven't arrived at that position because they read my papers on autogynephilia. They arrived at that position because they didn't like the idea of a biological male with an intact penis in a women's room. I don't think they're making nice distinctions here among etiological pathways to being in that woman's room.
I'm bringing it up because it's very important, because there's so much pain, there's so much trauma involved. Your name and Dr. Bailey's name, and I'm getting up there, it just gets lumped in with the same types of people. They're saying you're all hateful, you're trying to destroy trans, deny them their dignity or humanity. And so what can be done about that besides education? How else do we challenge this?
I'm not sure if it can be done in any rational way, and I'm not sure if any kind of educational program is going to affect this. It's a matter of public record that I've published something like 8 studies, all supporting sex reassignment surgery and hormonal treatment in appropriately screened adult patients. If a track record of 8 published studies, which any fool can find on the internet, is not going to convince people that I'm not anti-trans, I don't know what I could say that would do so. I think that we're dealing here with a group who have very powerful emotional needs to find an enemy on whom they can pin misfortunes they've encountered in their life. And whether I like it or not, I've been dragooned into service as one of those villains. The fact that the reality is the opposite, I don't think it's going to slow up too much of anybody. Look, all of us who are clinicians know there's a limit with which you reason with people who have delusional beliefs.
Okay, and then what about the flip side of that, which is those who say that by supporting medical transitioning or surgeries, you're a monster in that regard because children should never adults should never undergo that. How much are you experiencing it online? Do you get people coming to you? Like, how has that played out with you, the other side of it?
On Twitter, I've had to block both transsexuals and allies who were abusive because they perceived me as transphobic, and I've had to block some radical feminists because they perceived me as being not transphobic enough.
Right.
So I've had it from both sides. And I hate to do this because it makes me sound self-important, but every now and then I have to restate on Twitter, A, I believe transsexualism is a mental illness, and B, I believe that sex reassignment surgery is a reasonable palliative treatment for carefully selected adult patients.
I mean, they're not mutually exclusive. Obviously, you just said that, and it sounds so reasonable, yet your words get imbued with such hate, or people imbue them with such hate and bigotry. And that's one of the reasons I wanted to start the series way back when I did, because I want people to kind of step away from their own biases and to see the people behind the monsters that are being portrayed online and make their own decisions. So the sad thing is, I'm sure there'll be a lot of people saying, well, he sounds so reasonable. That's just because he's wearing his sheep's clothing right now because there's really a wolf underneath, right?
Well, when I tried to point out in online interactions that it's strange to call somebody transphobic who published 8 articles, 8 studies supporting sex reassignment, their comeback was that I did that because I was getting paid for it. As if the clinic I worked for was paying me piecemeal or commission per sex reassignment. So it was a no-win situation. Whatever I would say to say, no, that's not my position, they would find some crazy thing so that they could maintain me in the role of villain, which was how they want me.
Right, and that's why when you said earlier about you can't deal with like delusional people, it literally plays out as it would with someone with a bona fide delusion. No matter how much evidence you present, they somehow find a way to keep distorting reality to maintain their delusional belief or their false belief. And that's happening with you, as you just described. So again, I appreciate you coming on so that we can have a real rational discussion about all of this.